Thank you so much for joining me today for Making the Most of Medicare, preparing for fall open enrollment. My name is Chris Winterroad. I work for the New Mexico Aging and Long-Term Services Department. Um, and I am here to talk to you today about Medicare Open Enrollment, what you can do, what you can't do, and what to watch out for. We're going to start today with a land acknowledgement. The Aging and Long-Term Services Department recognizes the Indigenous peoples past and present that have been stewards of this region since time immemorial. These lands are home to ancestral caretakers of numerous Pueblo tribes who would come to include Mescalero Apache, Jicarilla Apache, and the Diné Navajo Nation. Each of the tribes has preserved and retained their language, stories, traditions, and maintains profound cultural ties to the land. As we come together today, we recognize and honor the significant contributions of all Native Americans. ALTSD also acknowledges tribal sovereignty and tribal self-determination and is committed to building connections with tribal leaders, advocates, and stakeholders who share our mission to support lifelong independence and healthy aging among New Mexico's older adults and adults with disabilities. Today in this presentation, we're going to discuss what is SHIP and SMP. We're going to do a brief overview of Medicare, and I'll tell you where to find more information about that if you need more. What beneficiaries can do during Medicare Open Enrollment and what they can't. I'm going to go over some fraud red flags. And I'm going to give you an overview of the kind of assistance, free, unbiased, and expert assistance that's available to you through the Aging and Disability Resource Center. All right, so I am the director of the SHIP program in New Mexico. SHIP stands for State Health Insurance Assistance Program. SHIP is a national program. There's a SHIP in every state and territory of the U.S. It's a federal and state partnership. We provide counseling, education, outreach. Really, I'm sure you've already experienced just how much noise there is about Medicare and during Medicare fall open enrollment in particular. SHIP is your source for free, unbiased expert information and assistance. SHIP counselors and coordinators do not represent or sell any insurance. We are here simply to help you navigate the choppy waters of Medicare during fall open enrollment and throughout the year. We're here to help people who are on Medicare. We also work with family members and caregivers who often take a larger role in helping make sure that their loved ones have the insurance coverage that they need for the conditions that they're facing. Our sister program is the Senior Medicare Patrol. Senior Medicare Patrol is also a state-federal partnership. There's one in every state and territory in the U.S. And the SMP is tasked with providing counseling and advocacy to help people protect themselves from and prevent Medicare fraud. During Medicare, all year long, but during Medicare Open Enrollment in particular, fraudsters and scammers come out of the woodwork, trying to get people's Medicare information so that they can drain the resources of Medicare that we all need for the future. So we can help you. The SMP is here to help you through counseling and advocacy, education, community outreach, help people learn to protect, detect, and report healthcare fraud. Again, we work with people who are directly impacted, and we also work with their family members and caregivers. You can find all of the information about these programs and more on our Aging and Long-Term Services Department website. It is at aging.nm.gov. You can see the Aging Services Department covers a whole host of resources and services, including adult protective services, the aging network, consumer and elder rights, which is what SHIP and SMP are a part of, our long-term care division, we've got the Office of Indian Elder Affairs, and our ombudsman who provide advocacy for people who are in long-term care facilities. If you want to look up an in-person event in your area, all you need to do is click on the Get One-on-One Counseling link at the very top of our website, and you will go straight to the calendar. I will show you more about that later. This is a great place to explore. There's a lot of information and resources available through our website. Okay, let's start digging in a little bit into Medicare. Just going to briefly go over the parts of Medicare because it can be very confusing. Basically, there are two ways to get your Medicare coverage. You can opt for Original Medicare, where you're getting your Part A hospital coverage and Part B doctor coverage directly from Medicare. If you go with Original Medicare, you can go to any provider that accepts Medicare. Medicare will pay 80%, you're responsible for 20%. You'll need a Part D prescription drug plan to cover your medications, and many people also add a Medigap or a Medicare supplement that covers all or part of the 20% that the beneficiary is responsible for, depending on which plan you choose. During Medicare Open Enrollment, if you have Original Medicare, this is your time to change your prescription drug coverage. Take a look at what your plan, your current prescription drug plan is covering for the coming year, and take a look to see if you can find something that maybe covers your medications better and saves you some money. You cannot change your Medigap policy. Medigaps are not included in Medicare Open Enrollment. You can also, if you have Original Medicare, decide to opt for a Medicare Advantage plan. That is an option during Medicare Open Enrollment. Medicare Advantage plans are still Medicare, but instead of getting your coverage directly from Medicare, you're joining a plan offered through a third-party insurance company that bundles together the Part A hospital coverage, Part B doctor coverage, and usually a Part D prescription drug plan. Not all plans have prescription drug coverage. That's definitely something you want to take a look at. If you want more information about how Original Medicare and Medicare Advantage plans works, we do offer a monthly live virtual Medicare 101. Those are on hiatus through Medicare Open Enrollment. The next one will be in January. You can find it on our website. But we do have a recorded version on our YouTube channel, and I'll show you how to find that later in the presentation. If you have a Medicare Advantage plan during open enrollment, you can drop that Medicare Advantage plan and return to Original Medicare by enrolling in a Part D prescription drug plan. You can also explore other Medicare Advantage plans to see if there's one that's going to better meet your needs and maybe save you some money also. Okay. If you're looking for information, the only place to look is either on our website, which is aging.nm.gov, or Medicare's website, www.medicare.gov. When you get there, it's going to look something like this. You'll know you're in the right place because it has a little American flag in the upper left-hand corner. There are a lot of copycat sites out there. We're going to talk more about how to protect yourself from fraud later, but you do not want to just Google Medicare and start clicking on links because that is like opening Pandora's box, and you're going to end up lots of places that look official but are not. Just a quick heads up reminder, any site that requires you to give any information before they'll let you into the site or they'll provide you with any information is a ginormous red flag, and you should just click right out of that immediately. The best thing to do is just type www.medicare.gov into your bar at the top of your web browser and go directly to that website. Once you're there, you can explore plans. You can log in to your account if you have one, or create one if you don't. You can look up information if there's a particular health condition that you want to find out more about coverage for, or anything else. You can do that on this website. You can also download an electronic copy of the Medicare and You handbook. If you didn't get one in the mail, or if you prefer to have it electronically, you can get it right from this website. Lots of things you can do here. It's a great place to explore how to make sure you're really utilizing all the benefits available to you through Medicare. Okay. For 2026, the cap on out-of-pocket prescription drug costs is going up to $2,100. So there still will be that cap on out-of-pocket prescription drug costs, but it's raised by $100 for next year. Starting in 2025, we have the prescription payment plan option. That's a great opportunity for people who take expensive medications to spread the cost of that medication over the entire year instead of having to pay for it all at once. If you take expensive medications, our SHIP counselors can explain the payment plan option to you. Your pharmacist should be able to explain that option to you. It can be very helpful for people on a limited income. It doesn't save you any money, but it means you're not spending all of the money at the same time for that expensive medication. If you have extra help or a Medicare savings program that helps with your Part B premiums and possibly other costs, you can change your prescription drug plan monthly. During open, this is just kind of for the whole year. This isn't specifically for open enrollment. There were some changes this year. It used to be you could change your prescription drug plan or your Advantage plan. Now, moving forward, you can only change your prescription drug plan. The only time you can change your Medicare Advantage plan is either during the Medicare Advantage special enrollment period, which is January through March every year, or during open enrollment, which we're in now, October 15th to December 7th. Okay. So during this special time where everybody can make changes to their Medicare coverage, what can you do? Well, the first thing you want to do is really prepare. People get inundated from October 1st on with an avalanche of Medicare information. So remember, you don't have to actually look at all of that. What you want to make sure you do is review your current plan carefully. Make sure it's still going to work for you. Every plan is required to send an annual notice of change or evidence of coverage, depending on which type of plan you have. And it's going to tell you if things are changing in your plan for the coming year or not. Plans can change how they cover things. They can change what drugs are on their formulary. They can change what benefits they offer and what the costs for those benefits are. Some plans are leaving the state this year. They're mostly Molina and United Healthcare plans. You may get a letter from your plan if you have a Molina or United Healthcare prescription drug or Advantage plan. You're going to want to pay attention to what that letter says. Call us at 1-800-432-2080 if you're not sure what you need to do. We'll be happy to help you make sure you understand what your plan is telling you and know your next steps. So Once you've carefully reviewed the information your plan sends you about the coming year, you need to just think about your health, how your health has been this past year, and what you think you may have upcoming in 2026. Sometimes people know they're going to need a shoulder surgery or they're going to need dental work. Um, Often, we just assume our health is going to continue the way it is, but sometimes we know that there are things that we're going to need to take care of. So if you are in that situation and you know something's coming up, this is the time to really look at your current plan and see if that gives you the coverage you need for that. You can explore plans using the Plan Finder on the Medicare.gov website. We will, if we have time, well, I'm going to tell you right now, I've got Plan Finder tutorials, live virtual tutorials, just like our live virtual workshop here today, that I'm going to be offering next week. Those will also go up as videos on our YouTube channel after the event is over. So if you want to use the Plan Finder and you want a little expert guidance on how to make sure you're paying attention to the right things and not missing anything, take a look at the ALTSD website. We have a calendar on there, and those events are listed. So you can get in there and make sure you have the tools you need to do your own Plan Finder research. You can also call us at the ADRC at 1-800-432-2080. You can get immediate assistance from an options counselor who answers the phone at the ADRC. You can request a phone appointment, and we also have in-person assistance available throughout the state. Okay, so what can you do during open enrollment? You can, as I briefly mentioned before, change from original Medicare to a Medicare Advantage plan. You can change your type of coverage. You can change from a Medicare Advantage plan back to original Medicare. Maybe you tried that out, decided you didn't like it, or your health conditions have changed and you want a little more flexibility and you want to go back to original Medicare. You can do that during Medicare Open Enrollment. You can switch from one Medicare Advantage plan to a different one that you think is going to better meet your needs. You can change from a Medicare Advantage plan that doesn't offer prescription drug coverage to one that does, or vice versa, from one that offers drug coverage to one that doesn't. There are specific circumstances where that might make sense. Before you drop drug coverage, I highly recommend that you talk to one of our Medicare counselors to make sure you're not going to put yourself in a bad position for the future. You can join a Medicare prescription drug plan for the first time. You can change from one prescription drug plan to a different one. And you can drop your Medicare prescription drug coverage. Again, before you do that, talk to us. Sometimes that might make sense and not cause any future problems down the line. Other times you're going to want to think about that carefully before you decide if that's the right choice for you. Okay, so if you want to look for Medicare prescription plans on your own, again, you're going to go directly to Medicare.gov. Type that straight into your browser window. Do not pass Google. Do not click anything, right? And you're going to click on Find Plans Now. You have the option to create an account and log in. If you do that, all of your medications that all the prescriptions that you've filled in the last year will show up in your account. Having an account gives you access to some information that can be really helpful, especially during times like our current challenges where with the government shut down, it's kind of hard to get some of the information that might be more readily available when the government is functioning normally. If you need a new Medicare card, right? Say you can't find your card, you don't know what your Medicare number is, you can access that. You can print a new card through your Medicare.gov account. So that's really, that might be important, especially now with the government shutdown. If you do create an account on Medicare.gov, you're going to need to have an email address, and there is multi-factor authentication to protect your information through this website. However, you do not need to have an account to explore plans. You can continue without logging in. The only information that the plan finder is going to ask for is your zip code. And that's important because plans are based on service areas. And so some plans are going to be available in one zip code that wouldn't be available in another zip code. So you do need to enter your zip code in order to see plans that are relevant to you. Once you're in the plan finder, you can look at plans and you can do a side-by-side comparison. This is just an example of what the side-by-side comparison is going to look like. It's going to include information about the star ratings, the health deductible, your drug plan deductible, the out-of-pocket maximum for Medicare Advantage plans, whatever premiums you have. Currently, the new Part B premium for 2026 is not yet available, and so it's not correct in the plan finder. It is going to go up. I don't have the information yet about exactly what it's going to be, but you can count on an increase. It's not going to be $185 next year. And it has a summary of the plan features, the extra benefits that the plan offers. You cannot trust the green check marks. The green check marks does not necessarily mean what you think it means. If you want more information about how to make sure you're looking at plans and really accessing all the information that's available on the plan finder, please go to our website, take a look at the calendar, think about attending the live virtual plan finder tutorials that are coming up next week. If you're looking at this video and it's later in the open enrollment period, you can find those videos of the plan finder tutorials on our YouTube channel. Okay, so when you're looking at a new plan, what should you be thinking about? How do you know if your current plan is good enough or if you really might want to think about making a change? Well, remember, your healthcare coverage isn't about the bells and whistles. During Medicare Open Enrollment, there's so much advertising, and advertising relies on creating a need. The whole point of advertising is to make you feel like you could get something better, right? Fear of missing out, FOMO, as the kids say these days. Well, they used to say that. I'm probably too old to know what they're currently saying. But really, don't fall for that. Your plan needs to meet your medical needs. That is the important thing. Don't get fooled by whatever flex cards or extra benefits and bells and whistles they're trying to grab your attention with. Go back to the basics. Are your providers in network? With the plan that you have or the plan that you're considering, are you going to be able to see the doctors that you want to see? Every year, every single year in January, we get calls from people going, I got this new plan and now my doctor doesn't take it. What am I supposed to do? And we have to help people find a plan that's actually going to work for them. So save yourself that heartache. Make sure your providers are in network before you even look at any of the shiny things that they're waving in front of you. This is most people's biggest cost, their medication. So you need to make sure, carefully assess whether all of the medications that you need to take are on the formulary of the plan that you're looking at. Is your pharmacy a preferred pharmacy for the plan? It is mind-boggling the difference it makes in costs for medication for whether a pharmacy is out of network, in network, or preferred. It can have an unbelievable impact on your bottom line for prescription drug costs. Then, and only then, after you've looked at your providers and your medications, should you take a look at what additional benefits, right? What else are they offering that might be helpful for you in the coming year? And of course, always come back to how will changing plans affect your costs? Okay, so what do you need to watch out for during open enrollment? Like we've talked about already, you're going to get inundated. It comes in the mail. It's on the TV. It's on the radio. You're undoubtedly going to be getting things in your email. You're going to see it everywhere. Medicare Open Enrollment. So plans are allowed to send you emails and direct mail. There's no way around that. There's a limited time period where they're allowed to do that. They shouldn't have sent you anything before October 1st, but there's always people who are pushing those boundaries. So they are allowed to send you direct mailing. That does not require you to look at them. So I want to go back to what we mentioned before, which is please watch out for anything that comes from your current plan, because you do want to really pay attention to that annual notice of change or explanation of benefits. That's going to be important for assessing whether your current plan is going to continue to work for you in 2026. But all that other stuff, you don't need to keep it, right? So sometimes people get overwhelmed. They feel like they have to look at everything, analyze everything. You really don't. You can hold on to it if that makes you feel better. You can also, I don't want to ruin your chimney, but you can use it in whatever way actually improves your life. So if a plan sends you an email, they must provide an opt-out, right? So you can, when you get that email, you can click the unsubscribe, okay? Plans are not allowed to send text messages unsolicited or call you or visit you in person to market their products without your permission. That's the catch right there, without your permission. So you may get a call from this has happened to people here in New Mexico. Your plan can call you to ask if you're happy with your current coverage. If you're like, well, it's okay, but I wish I had X, Y, or Z, what they'll do is they'll say, hey, can I call you tomorrow and we can talk more about that? And if you say yes, then you've given them permission to market their other products. If you see somebody set up in the grocery store or the pharmacy, right? Be careful what you sign. You may be giving people permission to market to you. Okay, so when do you walk? No, run away. Hobble as quickly as you can. I have a broken ankle right now, so I'm practicing my quick hobble. If anyone pressures you to join their plan, disengage immediately. You don't want to talk to that person. If they tell you that they're from Medicare, walk away, right? I am not from Medicare. I am a SHIP counselor, right? We're contracted with Medicare to provide free, unbiased information and assistance. I have a direct line to Medicare to get questions answered, but I am not from Medicare and I don't represent Medicare. I represent you. I work for the state of New Mexico. So if somebody tells you they're from Medicare, walk away. Anybody who makes you feel like you're missing out if you don't take their plan. Doesn't have your bet, they're trying to sell you something, right? Anybody who really has your best interest at heart is always going to start with what are your health conditions? Who are your providers? What do you need? Right? Because that's what's important about your healthcare coverage. Anybody who offers health screenings or other activities that may be perceived as or used for cherry picking is somebody who is conducting a marketing violation right there in real time. Plans often want to attract the healthiest Medicare beneficiaries because they're going to cost the least money to the plan. So you want to make sure you're talking to somebody who cares about your needs and making sure that whatever plan you choose gets your needs met, not that you're going to be a cheap date. So you also do not want to give your contact information for anything other than a raffle, because if plans collect your information for a raffle, that's the only thing they can use that information for. Certainly, if anybody tells you you're going to lose your Medicare benefits unless you do something, you want to stop talking to them immediately, right? Basically, anybody who's using fear tactics does not have your best interest at heart. And you have an alternative. You don't have to talk to those people about what your options are and what's available. You can go directly to Medicare.gov to find that out. You can go to our website, our YouTube channel to get more information to help support you in that. And you can speak directly with one of our SHIP counselors, either by calling the ADRC at 1-800-432-2080 or by attending one of our in-person events. Okay, so as I just hammered home again, we will be offering both in-person and telephone counseling to people through Medicare Open Enrollment. We do this year round. During Medicare Open Enrollment, we really try to make sure we're available statewide. We have over 100 in-person events scheduled for October 15th through December 7th to help people access the information they need to make a confident choice about their Medicare plan for 2026. So I'm going to show you after we're through the slides in this presentation, we'll take a quick detour to our Aging and Long-Term Services Department website, and I'll show you how to access our calendar so that you can see if there's an event coming up, an in-person event coming up in your community or in a community near you. You can also get that information by calling the Aging and Disability Resource Center at 1-800-432-2080. We have a beneficiary planning tool that really you can use no matter who you're getting help with, or even if you're exploring plans on your own. It just helps you organize the information you're going to need to get the most out of whatever counseling session or research you're doing. And I'll show you a picture of that in a minute. You can get one mailed to you by calling the ADRC at 1-800-432-2080, or you can pick one up at one of our in-person events. If you call the ADRC, the options counselors who answer the phone are all certified SHIP counselors, and they'll be able to help you through a plan search or answer questions immediately. If you have a little more complicated situation or you take a lot of medications, they may suggest making an appointment. We have appointments with SHIP counselors set up again throughout the open enrollment period. And we're taking appointments for those. We're scheduling those appointments now. On the beneficiary planning tool, it's going to include basic demographic information. The most important thing is your drug list and dosages. You need the exact name of the medication you take and the dosage, because it's a classic garbage in, garbage out situation. If you look at plans and you don't have the information about your medications, then we're not going to be sure. You're not going to be sure that those drugs are covered under any plan that you're looking at. And again, that is one of the biggest costs for most people. So it's super important to make sure that you have that information. And the purpose of the planning tool is just to make sure that you don't waste your time doing a bunch of work to find something that's not really going to work for you in the end. So it's really designed to keep it smooth, efficient, and effective at getting you the information you need to make that confident choice. And here's what it looks like more or less. Basically, you don't even have to provide your name. It's not relevant. Your zip code is important. As we talked about earlier, um, plans are based on an area. They're even if it's a prescription drug plan, they have service areas, but certainly if it's a Medicare Advantage plan, there's going to be networks that are going to be either active in certain areas, in which case there's a plan available, or not active. We're going to ask if you're interested, if you're looking at Medicare Advantage plans, in an HMO or a PPO. If you're not sure the difference between those two types of plans, you can look on Medicare.gov, and we'll also give you an explanation. It is important to know whether you get any assistance from Extra Help or if you have a Medicare savings plan, because there are special plans available for people who are dual eligible, who get both some assistance from Medicaid or Extra Help and are also eligible for Medicare. And as we talked about earlier, boy, making sure your pharmacy is in network really matters. So your information about your pharmacy, and you should think before you embark on this whether or not you're flexible in which pharmacy you get your medications from. Some people have a long-standing relationship and don't want to change, and that's going to limit your choices. And other people are happy to get their drugs wherever they cost the least. So just think about what matters to you in your medical care. Okay. If you have questions, you are welcome to chat them in. You can also go to our YouTube channel once this is up, and you can put your questions in there. We will be monitoring that and answering questions throughout open enrollment. Okay. You can, as I've mentioned several times, contact us through the Aging and Disability Resource Center at 1-800-432-2080. You can reach us at our website, aging.nm.gov, and we have a live web chat on our website. The person who handles our web chat is a real person and is right here in our office in Santa Fe, and is also a certified SHIP counselor. So they'll be able to answer your questions or give you guidance to the next step. We have offices in Santa Fe, Albuquerque, Las Cruces, Roswell, and Farmington. Currently, we are only accepting walk-ins at our office in Santa Fe. So you also have the option to walk into our office in Santa Fe at 2550 Cerrillos Road, and you can get in-person assistance that way as well. I hope that you will take some time to explore our website. Again, aging.nm.gov. We have many wonderful programs, including adult protective services. We have a veteran-directed care program that people can access through our, start the process of getting information about that through our website. Our New Mexicare program is an outstanding resource for people who don't qualify for Medicaid to get help with in-home caregiving services. Our long-term care department We have ombudsman advocacy for people who are in long-term care facilities. You can get information about the Aging Network throughout New Mexico on our website and our Office of Indian Elder Affairs. In addition to all of the programs we've talked about today with the ADRC, SHIP, SMP, and our other consumer and elder rights division resources. So if you want to know more, you want to keep up, you're like, wow, I didn't know all of this was here. How do I find out what's going on? You can follow us on social media at New Mexico Aging. You can subscribe to a monthly e-news blast. And you can go to we have a YouTube channel. I'll show you how to get to that from our website. Your feedback is very important to us. We need your feedback both internally and also our federal grant partners need to have your assessment for how well we're doing with those federal grant dollars that they award us. So if you have a few moments, please go to either the website at https://bit.ly/46019OU. That's a mouthful. Or you can use the QR code if you're fancy with your phone like that. All right. Thank you again so much for taking this time with me today. If you so choose, please hang around for another minute or two, another few minutes, and I will give you a quick tour of our website, show you how to find the calendar with our upcoming events and how to get to our YouTube channel. All right, I'm going to share a different screen with you now. Okay, here we are at the New Mexico Aging and Long-Term Services Department website. As you can see, right here at the top, you can click on this as a clickable link, and you can go to straight to our upcoming events. Right, here's the list of our events. Today's October 16th, and you can see we have 5 events right now going on today in Santa Rosa at the Campos Senior Center, in Tijeras, up in TA, in Reserve, in Catron County, and then, of course, this live virtual event. You can view the event just by clicking on the View Event button and get all the information about where to go for that. You can, if you prefer to look at your information differently, we have a calendar. You can see all the events that are coming up through October, November, and into December, right? We have all of our events scheduled on here. All right. I want to show you how to get to our YouTube channel. At the bottom of whatever page you're on our website, you're going to see at the very bottom an F for Facebook, the little camera for Instagram, X for whatever they're calling it these days. It's not Twitter anymore. And then the little play button. It looks like a play button on a VCR. I'm old enough to remember that. And that will take you directly to our YouTube channel if you click on it. And you'll see, here we are. So it's not up here yet, but you can see we have a lot of Medicare information. If you click playlists, you'll see a Medicare playlist. And you'll also see a SHIP and SMP playlist. You'll know you're in the right place because you'll see me. And then if you look at the playlist, you'll see the information that's there. Right now, this is last year's Medicare Plan Finder tutorial. after next week, I'll put up a new one, right? Here's last year's Making the Most of Medicare presentation. This presentation is going to go up there. But you'll see there's lots of things. If you're looking for information about Medicare, you can find it here. Lots of access to free, unbiased expert information and assistance. You don't have to listen to what they're telling you on the TV or what somebody who is representing particular plans has to say. Again, SHIP coordinators, SHIP programs, we do not endorse or sell any insurance. Our entire purpose is to help you have the tools you need to make confident decisions to make your Medicare work for you. So, I hope that this has been helpful for you. Call us at 1-800-432-2080 if you need more assistance, and I thank you for your time today.